After weeks of panic amongst Kenyans following the shortage of life-saving vaccines, the exercise has resumed in designated hospitals. This follows the arrival of 358,000 doses of the Oxford Astrazeneca vaccine donated by the Danish government. Health PS Susan Mochache, while receiving the vaccines at Jomo Kenyatta International Airport on Tuesday night, said the targeted priority group and those who had already taken the first doses will be the first ones to get the second doses.
US government has also offered to donate some vaccines, and Kenya is among the few countries that have already been identified to receive those vaccines. We'll be procuring 10 million Johnson & Johnson vaccines, and we've already put our commitment letter to the AU platform from where we will be procuring these vaccines. And so really we are on the right trajectory as far as vaccinating our people is concerned. We expect the 10 million doses in August. So from August, we should have sufficient doses of vaccines that should carry us through at least for the next 2 to 3 months after we have received them.
She noted that had it not been for the most recent donation, Kenyans would be left high and dry as only 5,000 COVID-19 vaccines were remaining.
So very well that the first dose goes a long way to offer protection. So really, already we have about 1 million Kenyans who cannot really get to a very severe form of COVID because they got the initial first vaccine. But most of us now are at the point where we require the second one.
Also on behalf of the COVAX facility, WHO, UNICEF and the other partners ask the other governments of the world to follow the Danish example of actually sharing the doses that they maybe have ordered at the beginning of the epidemic, and share those with the countries of Africa so that the whole world can be vaccinated.
According to the Danish ambassador to Kenya, Ole Thonke, despite AstraZeneca administration stopped in Denmark, the vaccine has proven to be safe.
Danish medical authorities, they completely agree with the European Medical Authority and WHO that AstraZeneca is a safe vaccine. The reason why it was stopped in Denmark was actually because we were receiving quite a few vaccines from other companies, Pfizer and Moderna, and at the same time we actually had quite a good control over the pandemic in Denmark due to very intense testing. At a certain point we tested more than 10% of our population every day. So as soon as someone got the virus, it was detected and we were able to keep the numbers low, and that was why the government decided that we actually didn't need the AstraZeneca within our program.
Same sentiments were shared by Acting Director General for Health, Dr. Patrick Amoth, who said it is effective against Delta variant.
One of the countries which has used AstraZeneca in a big population is UK, and you can see the cases coming down. And even if you are to be able to get infection or transmission, if you are to be able to get the infection, then you tend to get a milder infection that is not going to land you in hospital, and therefore your risk of getting a severe infection and death is highly reduced. So we still commend strongly. And in fact, one place where we are going to deploy this vaccine is the Western Belt.
So far, 192,093 people have received the second COVID-19 jabs, another 990,000 first doses administered. Total vaccinations stand at 1.18 million. Winnie Lubembe for Ebru TV.